I am the owner and medical director for NeuroRelief Ketamine and Infusion Therapy in Sherman Oaks, California. And you hear a lot about ketamine for depression. And I would say that, at this point in time, as a field, you still see, I would say about 90% of the services that are being performed regarding ketamine are for mood indications. I would say about another 9% are chronic pain related. And I would say less than 1%, if that, are for what we're going to talk about now, which is utilizing ketamine and other adjuvant strategies to treat and improve the efficacy of substance and alcohol abuse recovery. Just to give you a quick background, as Kaya mentioned, my formal training is as a cardiothoracic anesthesiologist. So that means doing the anesthesia, sort of subspecialized to do open heart surgery, heart-lung transplants, major trauma, sort of the big crazy stuff you see on TV, which you would think would be enough purpose to keep you occupied and not bored. Believe it or not, and having worked in corporate medicine for over a decade, I can tell you that I feel truly blessed to have found what I believe to be a true calling. And it's something that I feel very passionate about. It's close to home. And I think that our approach clinically is to really push the boundaries of what these strategies can accomplish, and also to widen the breadth of indications. And then when we find that something could be helpful, it's how are we going to make it the best possible outcome, not just is this molecule helpful for some people, for some things, but exactly how are we going to do that? How are we going to have the malleability or the flexibility to be able to adjust our approaches to figure out which protocols, which other strategies we can combine together to actually accomplish the actual goal, which is the outcome, which is the success, which is the improvement in the reason that people came to treatment in the first place. And what we also see is, in terms of acute detox, but probably even more importantly in chronic sobriety, hopefully, is why do people relapse? They relapse because they've lost the one thing that probably gave them a shot of joy, or at least their version of it, and now they're back into a gray world with its normal life stressors that we all have, and maybe even more so. But one of the big problems with drug and alcohol abuse, especially chronically, is it desensitizes the reward centers of our brain. In other words, we are no longer able to get even a normal, healthy bang for our buck when it comes to what are objectively beautiful or should be a sense of connection and reward from those stimuli, millions of which are around us every day. Ketamine resets those reward centers of the brain. Again, it's something our brain can do, but it usually takes about 7 to 8 years to have true 100% recovery of those reward instincts. With ketamine, we can often do it in a couple weeks. This is an fMRI, or a functional or fluoroscopic MRI, depending on who you ask, that demonstrates what I was talking about in terms of somehow this reignition of neuroplasticity. What you're seeing is a patient's brain that is being overlaid with a tag that is basically being able to isolate different proteins on the way that they refract light at different wavelengths. And so they've mapped out which proteins refract light at which wavelengths, and so they can identify the concentration of production of those proteins or the presence of them in different situations. And mostly this is a research or a comparative tool, but what you can see is before ketamine on the left, you see what is pretty standard in mood, pain, and substance abuse patients, and that is a very globally inhibited production of BDNF, brain-derived neurotrophic factor. And we see this almost universally. Okay, they've done hundreds and hundreds of thousands of these, and it's across the board. After you introduce the ketamine infusion, you see these exact same areas of the exact same person's brain now lighting up, really quite beautiful. And this is, not even one of the more dramatic before and afters that we see, but it is the increased production now, or I would say to a healthy level of the BDNF and therefore the neuroplasticity that our brains are actually capable of. So we talked briefly in the panel about what are some of the other receptors, what's going on at the molecular level, and we'll go macro again, but just to touch on this briefly, one of the main things that people talk about is NMDA receptor antagonism. But why is that important? If you remember in the panel that just occurred, I was saying how we have this balance occurring between a sort of activation system and a suppression inhibition sort of supposedly soothing or calm down system. That calm down system is the GABA system, and these inhibiting neurons are sort of side synapsing all over our neurology, both centrally and peripherally. And there's supposed to be a normal balance between how much inhibition, how much activation, and they're there to sort of keep homeostasis, just Goldilocks in the middle. However, over the chronic either stress response of depression, anxiety, PTSD, chronic pain, substance alcohol abuse, what you see is this inhibition is excessive and elongated. And what you actually see is then the ability for the synapse to do its work, which is basically the transmission of neurotransmitters from the presynaptic cell to the postsynaptic cell, such that you get a stimulus response postsynaptically, and that sends the signal downstream to where it needs to go. The inhibition is basically limiting and then eventually atrophying that synaptic structure. When you now introduce ketamine, and again, done correctly, what you're seeing is this NMDA receptor, which you see, this is the NMDA receptor on that GABA inhibiting interneuron. And then when you introduce ketamine, it blocks this. And what it does is it basically turns this inhibitor off. So it turns the off. There we go. And when that occurs, it relieves the weight off of that synapse. It's now free to do what it's destined and designed to do, which is go ahead and release glutamate across the synaptic space, and then increase in synapse formation and strengthening and that rebuilding that we're trying to accomplish. Another important receptor slash molecular occurrence that we sort of have normalized with ketamine administration is brain-derived neurotrophic factor, which I was talking about. This shows you basically the actual pathway that's taking place. So when ketamine binds to the AMPA receptor, it signals the production and release by the nerve cell itself of the BDNF. And that BDNF then is the building blocks, the foreman on the ground, and the awareness or ability to identify the locales that need to be reinforced, reprogrammed, or repaired. And again, that's going to lead to synaptogenesis, or the creation of new connections. We also spoke about voltage-gated calcium channels. Now, ignore the chaos going on in this image, because that's really not the point. The point is that these voltage-gated calcium channels are intrinsically important to the actual BDNF release, or the release of that synaptic repair and reprogramming tool. Now, when we talk about the recovery from substance and alcohol, again, I want to say that there's two important factors. There is the neurologic, or the receptors, and then obviously there's pretty much the reason why people went down this path in the first place. You know, the model that says, oh, some people were just born to be addicts or alcoholics, maybe, but if you look, you'll find that there's always a reason. There's always a pattern. There's always a similarity in the backgrounds or the occurrences or the environments that folks that seem to become more immersed in that life than, let's say, their counterparts. And whether it's a grossly genetic being passed down in the family, or what is probably more likely is, trauma runs in families. And so, the trauma of one person's childhood affects their formative personality, their defense structure, how they approach life and other people around them. And in turn, that will then turn to be the model and the impact that occurs on their offspring, and so on and so on and so on, passing on the same defense mechanisms, the same personality, let's say, traits, and the same sort of lack of coping skills or inappropriate coping mechanisms as a model for how they should approach life stressors. When we utilize ketamine, and our approach is, while I think that the psychotherapy or the integration during the ketamine administration is a very cool technique, and I think is very valuable. What we sort of promote is that we do that second. So at first, our goal is to really do this sort of harder reset. The actual subconscious, beyond the sort of cognitive strategy, is the really feeling able to safely, finally, for the first time in their life, be able to release control safely and realize that there's not only no danger in that, but much increased reward. That is a paradigm shift that they haven't even been able to approach before. Whatever therapy or other strategies they may have come across in the past, it was always done in the context of full awareness of the ego defense structure being in the room the whole time, and most of that just deflects off the surface, even if the client really does want to be the change that they want to see. So when we use ketamine at a deeper level, what we're doing is we're just sort of taking those ego defense structures and just saying, yep, thanks, you're no longer present. And it's, instead of beating their heads against the wall of that defense structure, it's just a teleport. Just beam me up, beam me down outside. And once they're outside, it's quite a revelation. And again, not a thought process, it's an experiential learning that, wait a minute, outside the walls, there's no monsters and dragons. In fact, it's green grass and cows as far as the eye can see. How long has it been this way? And then they look back, figuratively, on this sort of kind of confined, walled-off structure that their need for hypervigilance and control has really limited them to. And then they look around at the really endless sense of liberation and freedom and weight being lifted that is outside, and they go, the heck do I want to be in there for? Now, this is occurring at a fundamental level. It's not something they're going, let me analyze this. It's an experience that is fairly consistent when we accomplish what we're trying to. Now, our subconscious is, that system for us. It's there. It's always been there. It was a billion years in the creation. That how it does what it does, we probably will never know. It is probably the closest thing any of us will ever experience to the divine. And it's that much more wise. It just knows. It knows truth. It knows how to help us understand what is truth at an experiential level. It is that feeling of reward you get from emotional honesty, from being able to have the courage to be vulnerable and connect and interact with the world around you as just a small, grateful, humble creature, a part of something much bigger than us. That wisdom is coded in there, and it uses our feelings as the language to help us navigate through the processing and the emotional conflict resolution that we need. And again, how it does that doesn't matter. That's what it does. It is something, in fact, that as a modern society, I think that we've really lost. And that's probably one of, if not the biggest factor in why we see such an incredibly exponential rise in mental health struggles, and that is that we don't ever really feel comfortable or trust or faith in the environment around us to be able to be completely unguarded, like maybe civilizations were 250,000 years ago. You know, back then they objectively had far more trauma than we do today. And yet their experience of life was humble, accepting, grateful, a sense of wonder and awe of everything around them because it wasn't about them. You know, we live in this sort of pseudo-narcissistic phenomenon right now, and don't get me started on social media, although we all need to market. But the problem is that we are now living representative lives. We are promoting what we think the people around us want us to be. And our concepts of how we are supposed to pattern that relationship between ourselves and everything else around us has been modeled so badly that that subconscious, that truth, that ability to allow ourselves to heal just by letting it all go, by being unguarded, by being vulnerable, by allowing ourselves to have the faith in the connection of the people around us, community, family, whatever. We seem to have lost that, and I think we had it going a lot better a long time ago. Hopefully that's something we learn from. But the ketamine allows us to do that deep subconscious processing. Now, one of the, I think, most important factors, and one that we actually didn't touch on before, is the default mode network. Now, what is this? This is, if you've heard about the mind-body phenomenon, and you know, this is no longer some sort of hippie theory. Anybody who doesn't understand what's going on with this now really hasn't been paying attention. It's not some woo-woo concept, okay? It's anatomic, it's neuroanatomic, and it's neurohormonal. So, you know, when you have a stress response, you know, and the brain says, oh, adrenals, release some stress hormones so that I can be more vigilant and awake and energized. Well, that's great for the brain, but those neurohormones go everywhere, okay? Wherever the bloodstream goes, that will saturate. Those receptors aren't just in the brain, they're all over our body, okay? So the way that our sensory and the signaling that our body does to the awareness of our brain, all this is affected by, let's just say, the emotional or stress response of you know, our awareness and where we're investing the bandwidth of that emotion. Now, the area that we see and is probably most exciting right now, this default mode network, is sort of what we believe is one of the interfaces where the data from our physical experience, you know, there's hundreds of millions of neurologic signals being set upstairs all the time. Less than 0.00001% with a line over it are actually deemed appropriate to be part of our awareness or helpful to us. And the filter for that is this default mode network. However, when we have hypersensitization because of emotional trauma, long-term stress responses, et cetera, that starts to get coded into this interpretive interface. And what it means is that other signals coming through that may also be hypersensitized. So when you hear about people storing their trauma, well, we're talking about that in an actual very focal way. Ketamine resets the default mode network like a circuit breaker. And you know, done properly, what that does is it cleans the slate in a way, not just of the emotional trauma that has been sort of tightly held onto and influences the other signals that are coming through that same area, but also instinctively in terms of how we feel or how we feel able to focus the bandwidth of our awareness and then get the bang for our buck from that focus. So a common question we get asked is, okay, you're giving ketamine to treat substance abuse, are you nuts? But no, and no, there's actually not an addictive potential when it comes to ketamine, not in the way that we think about pretty much all other substances of abuse. Do people abuse ketamine? Absolutely. Is there physiologic dependency? No. Okay? And there's actually no physiologic dependency with all psychedelics, just for the record. But you know, when it comes to utilizing ketamine, obviously we should be doing this in a responsible way, and you know, that's why I'm not so much in favor of the sort of mass approach of just, you know, giving the whole population ketamine that they can use whenever they want to, because I don't think it necessarily is, you know, addressing the need to evolve our own coping mechanisms. We don't want to replace one problem with another. But that doesn't mean that there's actual addiction. And so, you know, when we do these protocols for substance and alcohol abuse, or for mood, or for chronic pain, we don't see it a habit forming, okay, ever. And it's also, you know, something that, you know, people come into the clinic for. It's not something that we're like, hey, you know, here's a vial of ketamine, you know, do you. You know, it's a very controlled process, and it teaches us in the course of that process how to develop our own coping mechanisms, not replacing the need for substance and alcohol with some other entity. Another kind of crazy thing that we get to be able to say in modern medicine with all the medical legal issues, especially in California, is this can't hurt you. Okay? 60 years, the pharmaceutical lobby have been trying to find something wrong with this, and they can't. Okay? It's a sort of an existential threat to them. And yet, here we are today, and I can assure you, if there was some long-term health consequences, you would see it on CNN tomorrow. They can't find any because there isn't one. And this gives us such a level of comfort to really explore, to say, listen, let's use this tool as, you know, a tool for good, obviously responsibly, but in a way that addresses that particular person's need, that doesn't bind us to, like, we're only going to do this one thing. So when it comes to substance and alcohol abuse, we need to talk about NAD+. When I talk about integrative strategies, that's what I mean. Okay, we combine micronutrient replacement, the integration coaching, NAD+, ketamine together with all that CBT, with all that mindfulness, with the 24/7 support and guidance to actually help people build. Well, NAD is the fuel. It's a cofactor in the mitochondria of every cell in our body, but especially important in cells that have a very high energy demand, such as brain, nerve, or muscle cells. It is a cofactor. It's a hydrogen or a proton donor receiver molecule that actually allows for the Krebs cycle carbohydrate breakdown to occur in the mitochondria, which turns carbohydrates into the energy for the cell called ADP. Without NAD+, we'd be dead in 30 seconds. Problem, over time, we lose it, okay? And now we're seeing that this actually may be a major factor in our aging process, but it certainly is a factor in the functional ability of each cell in our body. And at age 35, we've actually lost 50% of our NAD. Every decade after that, another 50%. Now, when we talk about substance and alcohol abuse, we see that the oxidative stress of that occurrence, we'll call it burning the candle, probably is most easily quantified in terms of the loss of NAD+. It is just simply consumed at such a rapid rate. And it's absolutely vital. So when we talk about withdrawal symptoms, we talk about the cognitive fog, the depression, the low energy level, the lack of motivation, all of which we see in substance and alcohol abuse and attempted recovery. We can pretty much reverse that with giving concurrent NAD+ infusions at the same time. It's also being indicated in a whole lot of other situations, and it's become a staple of our practice. We specialize in it. Pretty much all of the neurodegenerative and sort of other neurologic phenomenon that we see as being damaged over the course of many disease processes, We're seeing significant benefit when re-administering NAD+. That's why they are calling it the miracle molecule. When we give NAD concurrently or alone, we see significantly decreased cravings for drug and alcohol during detox and decreased cravings afterwards. In other words, long-term sobriety maintenance. And there seems to be a synergy between ketamine and NAD+. So ketamine is the motivation to repair, and NAD+ is the timber. It's the building blocks. So each one of them is great, but together they're phenomenal. Just to click through, this is basically the reactions that are occurring that NAD is a part of, and the mitochondria of the let's just call it brain cells, and eventually leading to the production of that ADP. It's vital. Protocols matter. Doing the right ketamine protocol is as important as showing up. We believe that the only appropriate minimum time that someone should be receiving ketamine is 2 hours for substance and alcohol abuse in order to reset those reward systems and actually have a hope of decreasing withdrawal symptoms. And again, we're not setting any minimum dosing. We don't start people at 0.5 milligrams per kilogram, which sort of has become an industry standard. We titrate to effect in real time, like its own anesthesia procedure, minute by minute, dialing it in to that unique person's specific neurology, psychology, personality, physiology, and tolerance levels, and then helping to push the envelope so that they're going to get optimal results and to challenge to overcome that wall. All this needs to happen simultaneously. We have a 2-hour protocol for substance abuse recovery, which is over 7 to 10 either consecutive or split days, and a 4-hour protocol for substance abuse recovery, which is 7 to 10 consecutive weekdays, Monday through Friday, pause, break, stabilize, and then continue. As I stated previously, every single one of our protocols is integrated. That includes a 2-hour intake with me. We go over everything, dialing this into this particular person and learning how to be the best guide for that person. Pre-treatment, integration coaching, and emotional work. Either the 120 or 240 minutes of customized ketamine infusion in real time, either 500 or 1,000 milligrams of NAD concurrently, whether that's the 2 or the 4-hour protocol, and allowing the patient to recovery with grace, allowing the patient to be able to reintegrate after their experience without being said, hey, sorry, we need this room for somebody else. That recovery integration period post treatment is absolutely sacred. And so we want to allow our clients to get the full benefit of that and to be able to bring back a lot of that connection, warmth, and sense of relief and safety from their experience back into their daily life. Cognitive behavioral technique and mindfulness training starts very first day, and then they are working on this on their own, as well as they are having 5-hour-long one-on-one live Zoom certified psychedelic integration and recovery coaching, and a lot of that training that these people have goes beyond sort of just regular therapy with ketamine. It's actually specifically focusing, and I believe some of the other physicians here have spoke to that as well, on how to utilize these tools for the most benefit and help the individual in a way that is customized to them for their particular setup. Invest the benefit of that new neurology and psychology in the how-to, in the practical application of how we focus the bandwidth of our attention and how we process the data of daily life. With the 4-hour protocol, we also do 1,000 ml customized micronutrient replacement, which is another wing of our practice. So who should do 2? Who should do 4? It's pretty straightforward. If someone's looking to reset their reward instincts, but they're not currently either abusing or they don't have a problem stopping, they're not anticipating any withdrawal symptoms, then the 2 hours is probably fine. If, however, they are either started withdrawal or expect to be starting withdrawal when they decrease or cease the substance of abuse, then they need to do the 4-hour protocol. That's what's going to actually have the results. With the 2-hour NAD is recommended, with the 4-hour NAD plus is required. We stand by our outcomes and our results, and so we know what is going to help people get those results. So again, combining all this together, ketamine therapy, NAD plus infusion therapy, CBT, mindfulness and daily meditations and exercises, teaching our brain exactly how to rebuild those new roads, telling our brain how we want it to repattern and reprogram. And the certified integration and recovery coaching that is, again, customized and detailed in regards to that unique person, not some generalized spiel that we tell everybody. This has to be about them, and they have to feel that to be able to apply that advice and to be able to practice the change that they want to be experiencing. Thank you guys so much for your attention. I really appreciate it. And if you guys would like to stay and ask me any questions afterwards, I'd be more than happy to. Thank you guys so much.